everybody. Hi. Welcome to AskAwayHealth Live. I'm Dr. Sylvia, a general practitioner and health educator, and I am sorry that I'm starting, like 20 minutes late? Forgive me. There's so much going on. There's so much going on, but I'm so glad to be here today. I hope you are doing well. How are you? I hope you're doing well. Thank you so much if you just clicked onto this video because you're interested in the topic. Thank you. I hope you will gain one or two things from watching. I haven't even got my microphone on. That's just to tell you how organized I am today. But while I put it on, please share this video. Oh gosh. Please share this video. We're talking about a common but little discussed problem that affects men and women. Hang on, let us plug this in. And just hope that the gremlins don't show up today. Let's hope that the tech are just too tired to work in the sun. Okay, so we're going to be talking about chronic leg pain, and my focus is on PAD, peripheral artery disease, or you might also know it as peripheral vascular disease. I hope that helps the sound. Somebody let me know. Or intermittent claudication. I'm going to talk a little bit about what that's about. But let me just set the scene, okay? So let me just set the scene. Consider, if you will, okay, consider if you have or if you develop a mild ache in the leg, maybe when you're walking, taking a walk, or you're exercising, you develop a mild ache in your leg, you ignore it because when you settle down and you rest, it gets better. So you forget about it. And then it comes back again a couple of days later. And then over time, it seems to be happening more and more often. This carries on for weeks and then months. Okay, that is the time that you really need to be talking to somebody about this, shouldn't you? So this is a little bit of an example of what we're talking about. It's not a leg pain because you've pulled the muscle or because you've fallen down or because you were in the gym and something happened. This is a leg ache or pain that just sort of starts gradually in most cases and then continues. And you have to ask yourself, what is going on? So we're talking about, and I also have to distinguish it from blood clot or DVT, which I will explain a little bit when we go into what the specifics for today. So we're going to be looking at what is peripheral artery disease in the lower limb, what causes it, how common is it, and what happens if you have it in terms of how do we diagnose it, how do we treat it, and possible complications. That's what we're going to be looking at today. And I'm going to try and be very organized and sort of put my title headings in the chat as we get in the stream, as we get to those different areas. But before we get started into it, thank you so much again for joining. I'm really thrilled about the channel because we are just maybe just slightly over 500 subscribers away from 20,000. And I think to myself, when it was 200 subscribers, and I didn't imagine that we could get to 20,000. So I want to say a special thank you to everybody who's made that possible. And also to let you know that my community membership is open. So you can become a community member and key into the different perks that we have. Apart from getting some direct responses from me, you can also select the different videos that will show on the channel and help me to grow this health education network, because that's what it's important, how we dismantle misinformation and build accurate health information. So a shout out to my 20,000 members coming up soon, I hope. And please, if you're in the mood to do so, go ahead and like this video, subscribe to the channel, get me a super chat or super sticker if you feel that this is what you like to hear and you like the work that we're doing. It will be very much appreciated. So we are talking about chronic leg pain with a focus on peripheral artery disease. Guys, if you're watching live, let me know where you're watching from. Thank you so much for joining. I'm really pleased that you're here. We are just starting on the topic. You haven't missed a thing. And I'm going to begin with the very first bit, which is what is peripheral artery disease? Okay, so we're talking about chronic leg pain, but peripheral artery disease, or PAD, is a common health condition where fat deposits build up in the arteries, that is the blood vessels. And I've got you guys know I love to spoil you with images and graphics. So here are your blood vessels in your legs. Okay, so these are your blood vessels. These ones look pretty healthy to me, although you can't tell what's going on inside, but this is how they flow. You've got large blood vessels, you've got smaller ones, you've got a mix, okay? But in peripheral artery disease, a problem arises because fat, cholesterol, and some other waste material, some other toxic material is building up within the blood vessels and affecting the flow of blood. So as you can imagine, This will effectively narrow the artery, the space in which the blood should flow becomes narrow, and blood flow to the legs, the tissues in the leg are restricted. And what you will end up with is what you can see here. If you just watch this video a little while, you see that the blood cells can't pass through easily. Can you see where they're being blocked against the yellow cholesterol fat deposit there? So that is the challenge that happens when the blood vessel becomes blocked like this in peripheral artery disease. Okay, so we call it peripheral artery disease of the lower limbs. It's also known as peripheral vascular disease. You might have heard it in that form. It is a type of cardiovascular disease. So it's a disease that affects the heart and blood vessels. So it's really important. I know that we're all more keyed into things like high blood pressure and heart attacks and strokes, but this is also an important type of cardiovascular disease. So what are the symptoms? What are the symptoms if somebody has this condition? Of course, I've already given it away by telling you chronic leg pain. So yes, leg pain is one of the symptoms. But like many conditions, in the early stages, there may not be any symptoms. Remember, I just showed you this nice looking circulation picture for this person, but you don't know whether in the blood vessels the disease has already started. It may have started and they're not showing any signs. So that's a possibility that you might have, no symptoms when it first of all starts. But when it gets into the grip, when things become progressive, people will commonly develop a painful ache in their legs, usually the calves, but it can also go into the thigh and the foot, but usually in the calves. And that ache develops when they are walking or exercising. So walking, really, they develop an ache, and that gets better after a few minutes of rest. Let's not confuse it with you're doing some exercise and perhaps you get a bit of a stitch or cramp, which relaxes after you've rested, because that may have something to do with whether it may have something to do with muscles that are not properly stretched before your exercise begins. We're talking about something that is chronic. You notice a pattern, because with the kind of stitch or cramp you get after exercise that you've not warmed up your muscles beforehand, next time when you do your exercises properly and you warm up, then you're less likely to have that. In this scenario, even if you've done a nice warm up, you find that you walked a few minutes or done some bit of exercise and then develop this ache or this cramp that doesn't go away unless you stop what you're doing. It's also known as intermittent claudication. So intermittent claudication, that's something that you may have heard before. Claudication referring to the pain, claudication referring to the pain that you have, and intermittent meaning that it comes and goes, so that it goes away when you rest. Okay, so that's one of the symptoms. We said it may not show any symptoms in the very early stages, but then as it progresses, you begin to get those type of symptoms. What else could happen for somebody who has chronic PAD or who has peripheral artery disease? Now, the pain could be mild. It could be, something that you just don't take very seriously, especially at the beginning, or it could be quite severe or somewhere in between, okay? And please remember that it usually goes away with rest until you get to the very advanced stages, because what's happening, remember, that's what I showed you, because what's happening is that you have the fat deposits are gradually building up. Eventually, they will almost completely block this vessel if this is not treated. So it's still allowing a little bit of blood to go through. By the time it continues to grow in size, the fat deposit continues to grow in size, restricting blood flow to the tissues in the legs. You will imagine that the pain can get worse. Commonly, this condition will affect both legs, although it may appear a bit more painful on one side. So that's the principal symptom you might have with PAD, but there are other symptoms which I've also listed here. I'm trying to be very organized. Okay, we're still talking about what is peripheral artery disease. Other symptoms that you might have that might be affected or that people might experience are loss of hair on the legs and feet. Because think about it. If the supply of blood is not getting to the tissues, i.e. the blood is not delivering oxygen and the nutrients that the cells need to grow, the hair needs to grow, and so on, of course, you're going to experience some loss by way of hair loss. You might experience numbness or weakness if you have nerves involved. The nails, which also depend on the nourishment and oxygen supply, they don't grow well or they're brittle. And of course, open wounds on the feet or legs, that wound that refuses to heal properly, or ulcers that don't heal as they should with time. They just don't heal. You look after them, you treat them with you keep them clean and so on, but the body is not doing what it should do. It may be because there's a peripheral artery disease thing going on. What about the change in color? The skin color might change, and this may be trickier to see on skin color like mine or darker skin, because you don't see it changing to paler or looking darker. But we also rely on the other symptoms and just having a good eye to have a suspicious eye that, oh, even though the skin is dark and you're not seeing the exact paleness or pallor that you'd expect, doesn't mean that the disease is not going on. In men may have erectile dysfunction, trouble getting an erection because of the reduced circulation. Because think about it, let me bring up one of my images again. Think about it. This problem doesn't just sit down and affect one blood vessel randomly. It could affect different blood vessels. So the lower limb circulation, as you can see, is coming from the big blood vessels from the heart. And if you have any of those big blood vessels being affected as they travel down to supply the lower legs, they can also supply the groin, the pelvis. And that way you may have disease that also causes erectile dysfunction, where the reduced blood circulation to the penis, to the male organ. And there may also be shrinking of the muscles of your legs because, as I've said before, oxygen is not coming through as it should. So guys, thank you so much if you're joining the stream. Thank you for clicking on. My name is Dr. Sylvia. I'm a general practitioner and health educator with AskAwayHealth. And we're talking about what causes that chronic leg pain. Be careful, please don't ignore it. This is different from a blood clot. Let me just quickly make that difference, where what you have is usually for similar reasons, it might be because of waste cholesterol inflammation allows thrombus, this body of tissue or type of tissue to collect in a blood vessel. And over time, either because of particular conditions, for example, it's more common in pregnancy, or if somebody's blood circulation is not very good because they're not very mobile, or some people have certain health conditions that make them more likely to develop blood clots, then this thrombus forms, this piece of tissue forms within the blood vessel. And again, it can be made up of fatty deposits, it can be made up of different bits and pieces, platelets, that's different blood cells, all of them come together to form this thrombus. And then it comes off. Okay, the thrombus can come off and travel to different parts of the body, but it can also stay in the blood vessel. It can stay in the blood vessel, that is the vein this time around, and cause blockage in the supply in the vein, which is what also causes the ache. But remember, you have different blood vessels. In this particular case, we're talking about peripheral artery, that is the artery which brings blood from the heart to all the other organs. But in the blood clot or deep vein thrombus or thrombosis, we're talking about a blockage in the vein, which is the vessel that takes blood away from the organs, the vessel that contains waste, taking blood away from those organs towards the heart for it to be cleaned up and to get a fresh supply. So that's a little bit of a difference. We're not talking about blood clots today, even though those are also quite serious. We're talking about something different, peripheral artery disease. So we've talked about what it is, we've talked about the symptoms, and now we're going to go to the very, I beg your pardon, we're going to go to the very next subtopic, which is what causes it. So who's likely to get it and why do they get it? If you're just joining the stream, thank you. I hope you get a couple of things, useful things from today's class. Please give this video a like and do consider subscribing to the channel, or get me a super sticker or super chat. That would be most appreciated. So what causes peripheral artery disease of the lower limbs? Well, growing older. I bet you have thought about that before I said it. It is more common in older people. So, but that doesn't mean if you're in your 20s, you just switch off and think, okay, I'm not bothered by this. Please, to be forewarned is to be forearmed, as we used to say those days. But yeah, it's more common in older people. So as you get into your 40s and 50s, your risk will gradually increase if you're going to have this condition. But generally, we do find that it affects people more in the sort of 50, 60 age group and onwards. So growing older is likely to be associated with developing this disease of the lower limbs, as well as certain conditions. Let me get my graphic up for you, which I hope, no, I haven't even downloaded that one. That's a shame. Okay, so other conditions that are associated with peripheral artery disease include smoking, and smoking actually is the most significant risk factor. And the reason for that is because it encourages the formation of these fatty deposits. Inflammation because of the toxic material within the cigarette, whether it's cigarette smoke or pipe or tobacco or whatever it is, or nicotine that you're smoking, contribute towards the formation of these deposits. So you have a mixture of toxic materials plus cholesterol or fat plus blood vessels and other waste materials that arise, and they cause these deposits to build up and damage the blood vessels. So smoking is one of the culprits. Another condition is diabetes, and that can be type 1 or type 2 diabetes, high blood pressure, high cholesterol, which I know that you wouldn't be surprised to hear that, because you can see from this image I've got going on the screen that fat and cholesterol is a key aspect in the problem that develops in this artery and the blood vessel. And being African American, so this is for American population, obviously, but there has been studies indicate that this condition seems to be more likely in African Americans. But then it shouldn't surprise you, because conditions like diabetes and high blood pressure also have high incidence in this group of people. So if you're an African American or of Afro-Caribbean or African origin, please, let your parents know about this, your older sisters and brothers, or yourself. Please be aware of the possible increased risk you might have with this condition, peripheral artery disease, with age, diabetes, high blood pressure, high cholesterol, or with your ethnicity. Okay, so let's go on to the next. We just finished talking about the causes and who might be at risk of developing this condition. So let's talk about how common it is. I'm just switching between let's talk about how common it is. So, I've said already that it's something that happens in people who are older. That is quite true, happens in people who are older. However, studies tell us that it is more common in men than women. Now, I have a little bit of an issue with that report. I'm not saying that it's totally wrong, but we know that historically we don't have enough data that tells us about how common heart problems are in women. So we always seem to have the mindset that they're more common in men, and there might be a slightly higher risk in men, okay? You remember that this condition is a type of heart disease. And I want you to get into your mind that this is heart disease that's affecting the leg. So the first thing that you might experience is leg pain, okay? But then it boils down to a heart and blood vessel disease. All right, so it's more common, according to the studies, it's more common in men than in women. But let's realize that women do have a high degree or high numbers when it comes to heart disease. It's just that the data is not as robust. It's not collected as well as men, because in women, perhaps they're less likely to come to the attention of the doctor and is blamed on something else. I've done videos on this before. Let's not digress. But at the moment, the thinking is that it seems to be more common in men than in women, but please, that doesn't mean that it cannot happen in women. According to the American Academy of Family Doctors, the condition affects 1 to 2% of people under age 60. So if we had a group of 100 people in a room, okay, you're likely to have 1 or 2 of them with this condition. So it is quite common, okay? It's not something so far off. And by the time they get to over the age of 70, out of those 100 people, 18 of them will have it. So this is how common this condition is, okay? If you're just joining, hello, thank you so much for joining the stream. You're very much welcome. We're talking about this chronic leg pain, what it is, how it's associated with the heart and the cause. And I hope if it's something you're interested in, you go and watch the replay and see the different bits we've talked about. So we've just covered how common is peripheral artery disease. Let's go to the very next section, which is what happens if you have peripheral artery disease. Now, when you first come to your doctor with this story, like I displayed in the beginning, of this ache that started gradually, but now it's getting worse. Every time you walk, you get this pain, but it goes away when you rest. And so on. And perhaps you may have the other symptoms, maybe some numbness or weakness, or you notice that the skin over your leg is looking different. It might be looking shiny or looking different to other parts of your leg. Of course, your doctor will examine you afterwards, and we can check the pulses in your feet, in your legs, to see if there are any changes So those are some of the things that we can begin to do to start working out what's causing the problem. But you then also go on to have other tests, checking the blood pressure in your arm and your legs and comparing them to see if there's any difference. So this is referred to as the ankle brachial pressure index. We're just checking that if the blood pressures in one part of your body are different from another. So usually comparing the arm pressures to the leg or to the lower limb to see if there's any difference. Other tests that would happen include scans. So first an ultrasound scan. You could also have an MRI scan or CT scan, depending on the symptoms, depending on whether or not the previous test did not show up, then you may have to have advanced scans. So there are a few things that your doctor, your specialist will do to confirm this problem if diagnosed. And remember, we said it's more likely to happen in somebody who's got high blood pressure or diabetes, especially when it's not controlled, or in people who smoke. What about the treatment? Now, if you're a follower of the channel and you watch our videos where we talk about lifestyle changes, they are really important in helping to modify some of these diseases. And I'm talking about things like stop smoking, which, as we've said, smoking is a principal culprit in the development of this condition. That's a no-brainer, isn't it? But other things are regular exercise, losing weight, which of course would help you if you've got diabetes or if you've got high blood pressure. Moderate your consumption of alcohol, because that over long term could also affect your blood vessels. So those are the key things that you need to do in terms of your lifestyle changes. But you could also have what's called a supervised exercise, and that therapy will do a lot of things apart from helping in weight loss, but also helping to improve your exercise tolerance, helping your muscles, as well as other things that might be in play. And of course, depending on how severe the disease might be. Okay, so it may be 2 hours of supervised exercises every week for a 3-month period, for example, encouraging people to exercise to the point of maximal pain just to try and build up the tolerance. But of course, that will go hand in hand with other treatment measures. Now, if you've done all that and lifestyle and exercise are not really helping, then surgical options will go on to surgery. Okay, so the first thing that your doctors or your specialists will be thinking about is an angioplasty and stenting, which is where they're going to try and open up those blood vessels. Let me show you. Let me just bring the picture back, the image back again, so that you remember what we're talking about. So we're dealing with this blood vessel that is slowly being narrowed by this fat deposit. So angioplasty is going to go in to try and open it up, remove this blockage, and insert a stent that will help to widen the blood vessel so that blood can circulate. Because basically, think about a tube or a channel that's blocked. You're just trying to reopen it and allow blood to go through. So you might be able to do that just by making it wider, but you may also need to introduce a stent, that's a metal device, to keep the artery open. If that is not suitable, if angioplasty is not suitable, or you don't want to go through angioplasty, or it's not, your disease is at such a stage where angioplasty is not going to help, then another option is bypass surgery and grafting, where a healthy artery is then used to bypass the blocked one. Okay, so if it's something that you're suitable for, so again, it depends on the individual. If it's something that you're suitable for, then bypass surgery and grafting is another option for those who have this condition. Now, I know you're going to be asking me, doctor, are there any drugs that can help with this problem? You can see that a lot of this is mechanics, isn't it? But there is some medication that your specialist might want to consider, and it's worthwhile discussing with them, because there are options. There's some people who don't want to have surgery, of course, so it can be an option if exercise hasn't made any difference for some stages of disease, maybe mild disease, or if you're, as an individual, you're not really keen on surgery. So those are the sort of treatment options you have for this problem. The key thing is being aware that it exists and not ignoring chronic leg pain. Remember, one of the things that people do is, I'm growing old, it's an age thing. Please don't do that. Okay, if it's something that is in the format of what I've described, this ache that goes away when you rest, and it's happening over, sort of coming into a pattern every time you're walking, it tells you that the disease is progressing. Please don't ignore it. Please don't. Or people say, it's just a muscle cramp, it's just a stitch. Let us not ignore it. Because if it is not treated, and I'm coming to this is an important bit, if it's not treated, if we don't find it, if we don't diagnose it, it can lead on to other heart problems, okay, heart related problems. So disease of the heart itself. So these blood vessels that are being blocked, this where's my picture again? This blood vessel that's being blocked with fat and all that, it can progress to other blood vessels in the body. So it might happen in the leg, but the disease might travel to other parts of the body, including the heart. It could cause a stroke. It can lead to heart attack. It can lead to angina. So it can cause lots of other problems. But I can't finish this without telling you about a very severe problem that can develop if the blood flow becomes very restricted, if it becomes tightly restricted. A condition known as critical limb ischemia can develop. This as an emergency. That's a medical or surgical emergency. Severe pain, acute pain that just develops suddenly. Anybody having sudden severe pain in the leg or anywhere, of course, you should be reporting to a healthcare practitioner. And very rarely would you have a situation where it's not something serious like a blood clot or what I'm trying to describe here, critical limb ischemia, because that means that the blood vessel is almost completely blocked. So blood is not getting to the tissue, is not getting to the legs as it should. And it will cause things like gangrene, the possibility of losing the leg or even death are there. So guys, yeah, this is what I wanted to share with you today in today's class about peripheral artery disease. I don't know if you guys have any questions. I've got a few people who've been dipping in and out of the chat, which is into the stream, which is fine. I just hope that this gives you a little bit of information that you can sort of store in your head or share with somebody that you love or a friend so that they can consider this problem and speak early to their doctors if needed. Thank you so much for joining me this afternoon. Now, let me let you know I've started a new section on my stream. I'm coming back in about 10 minutes tops, okay? Because we've got a new segment that I want to start, which is looking at ongoing topical health issues, and I'm calling it Watch This Space with Dr. Sylvia. I'm back in about 5 or 10 minutes, literally. And I've got an interesting one today that I want to talk about with you, which is about a blood test. They said it's new, but it's not new. But it's a blood test that can detect 50 types of cancer. Have you heard about this? What do you think? Please come and join me in the next live stream. Literally 5 minutes away, I'm coming right back to talk about this. And this segment, or this new live stream segment, will be starting. I think I'll make it a regular Sunday thing. Not more than 5 or 10 minutes, guys, just to go through the latest information out there and see if this is worthwhile. Is it worth something that we should watch out for? What are the pros and cons of the condition or of the treatment or whatever? I'm really excited about this particular one, and I hope that you're going to join me. But guys, thank you so much for watching this one today. I hope you found something useful talking about leg pains, what's causing your leg pains. If you have, let me know in the comment section. Give this video a like, and I will see you again soon. Bye-bye.